first thing to say is that the Pfizer vaccine was used in 16 years plus, the AstraZeneca in 18 years plus. Neither were used in children, or the data are not yet available for whatever's been done in children. And that makes it a little difficult because we're working with a vaccine that has not really it's not been, the regulatory authorities have said is for adults, essentially. Doesn't stop us using it in children, but the issue there is whether we need to use it in children. And the data we have, I'm afraid, because you're talking about vanishingly small numbers of people, and most of the children who are high risk would have been shielded very assiduously by their family, and therefore would not have been exposed. And that means that we have basically a lack of data about whether COVID is a risk for patients, for children or adolescents with certain conditions, because they basically didn't get COVID during the first wave. Very few of them did. The only signal that we've seen in the data is that children with neurological disabilities do seem to have a higher risk of infection and mortality, and they have been suggested that they should be vaccinated, although it needs to be discussed with the carer and the medics who are responsible for those individuals. This is close to my home because I look after patients, adolescents with graft versus host disease, and I worry the hell out that they will get COVID and their lung function is so poor that they won't do very well at all. So I think it is possible for individual clinicians, for specific adolescents who have really high risk, that they will get the vaccine. But it's a very small number of people that we're talking about.